The Self-Employed Women's Association, SEWA, is a union of 220,000 women workers of the unorganized sector in India. These workers constitute 93% of the Indian workforce. They do not have regular salaried employment with welfare benefits, no weekly day off, sick leave, pension, nor any maternity benefits. They are the poorest of workers and yet very economically active, accounting for 63% of GDP in India. Among these workers, women are the poorest and most vulnerable. They are engaged in the most hazardous and low-paid work in the unorganized sector. These women are home-based workers, hawkers and vendors, and manual laborers and service providers. Organizing such workers was not easy. From the start, policymakers and even the labor movement questioned the very idea of organizing these workers. Moreover, organizing women in a culturally diverse and male-oriented society was a slow process. It involved uniting very poor women by encouraging them to come out of their homes and lead their own groups and union. SEWA organizes these women workers for full employment and self-reliance. Full employment means such employment at the household level which ensures work security, income security, food security, and social security. By social security at SEWA, we mean healthcare, childcare, insurance, and shelter. Self-reliance means that women should be autonomous and self-sufficient, individually and collectively, both economically and in terms of their ability to make decisions. SEWA's dual strategy of organizing through struggle and development helps it achieve its goals of full employment and self-reliance. Today, SEWA has promoted more than 1,500 small self-help groups, cooperatives, and district-level associations of women in India and abroad. This is the SEWA movement. It incorporates the women's movement and the labor and cooperative movements. Gandhian thinking is the guiding force at SEWA.
For the last 18 years, I have been sewing garments. I have many health problems. I cannot see clearly and I have chronic backache, but I have no access to medicines nor treatment. I am a salt loader. We have no equipment. I work deep down up to my knees in mounds of salt. My feet and legs keep on bleeding. Even if I wash my hands properly, some dye always remains. I know that I am going to fall sick. But what can I do? I have to work to satisfy my hunger.
Health security of women workers in the informal sector has been a key concern of the SEWA since its inception as a union in 1972. It was evident that unless the health of women and their families significantly improved, they would never achieve their goals of full employment and self-reliance. SEWA members, all poor self-employed women in India, repeatedly emphasize that their health is their only wealth. Poor health status affects their productivity, and their hard-earned money is spent on expensive health care. On the other hand, good health status enhances a woman's productivity and hence ability to work and feed herself and her family.
I am Nanduben. I was a mere agricultural laborer. My mother was a midwife and taught me how to do deliveries. SEWA also gave me many more health trainings. I am now a community health worker for SEWA.
The main health activities at SEWA are occupational health care, including provision of protective equipment such as sickles for agricultural workers to reduce body strain, promotion of low-cost traditional medicines and remedies like local herbs and massage, and sale of low-cost rational drugs through 3 shops and 60 health centers.
My name is Geeta Ben. We give training to our sisters in the villages to create awareness among them. Many of our members are weak and undernourished. When we see pale, anemic women, we advise them to take iron tablets and eat green leafy vegetables. If a woman is pregnant, I weigh her, give her iron tablets, and take her to the local health center for vaccinations. If a woman tells me that she does not want a child for some time, I advise her of birth control options. I suggest birth control pills to her or take her to a midwife for insertion of a copper T.
These health workers and midwives are active in 100 villages and 9 districts of Gujarat state and have been able to achieve the following: health education, 11,000 women and 1,000 men; curative care through health centers and camps, 55,000 women, 40,000 men and 27,000 children; sale of low-cost rational drugs to the tune of 6 million Indian rupees; tuberculosis care of 900 women, 700 men and 240 children; immunization of 30,000 children; family planning including and involving 7,000 women and 2,500 men. SEWA also works for policy changes in health at district, state and international levels. SEWA has been actively involved in slum upgradation programs, collaborating with government to bring water, sanitation, toilets and other basic amenities to its members. We have initiated mobile health dispensaries in the remote desert areas working with the government, and we have also initiated a campaign for greater recognition and involvement of traditional birth attendants or DAIs in reproductive and child health, including provision of identity cards and skill upgradation training.
If I examine a pregnant woman and feel that I may not be able to do her delivery successfully, I refer her to the local civil hospital. At SEWA, we believe in self-reliance. We have our own Lok Swastha Mandali or health cooperative. I have been elected a committee member. Our 5-member team runs the cooperative and we earn our living through it. Previously, I was introduced as somebody's wife or daughter-in-law. But now the village headman and other prominent men call me Nandu Ben, the village doctor. They respect me. I thank SEWA for what I am today.